30 minutes your results will be out.
A lot of effort has been put in place to educate people on how they can protect themselves from HIV and AIDS. Most people who live with the virus know the importance of medication.
If I tell you you're positive, you know what to do.
However, experts say frequent counseling services are missing. According to Evelyn Koni Karono, a counselor at the Uganda Counselling Association, frequent counseling should be added to the services given to the people living with HIV.
Mental health in itself, I would say that very few people have yet appreciated how much mental health is part and parcel of the physical health. So by the mere fact that they do not know, so they will not even come, and yet we know that they are there, they suffer a lot of stress, emotional stress, psychological stress, mental health issues.
She says disabled people living with HIV are also neglected. Laura Marshall, the Norwegian Refugee Council representative in Uganda, called upon stakeholders to make sure that disabled people are part of management in the public and private sector.
First of all, we would like to take some responsibility for this, because when I look at our organisation, I don't see enough representation of people with disabilities. I think we have to start close to home and say to what extent are we, walking the talk on this one. And we, as many other organisations, have a long way to go to make our organisations properly inclusive. For others, I would really encourage people who are policymakers and in charge of organisations to look around their organisations and ask themselves, are their organisations actually representative of the communities that they serve? Do you see people with disabilities amongst your staff? And if not, why do you think that is? And put in place policies to start to change that, because I don't feel that people with disabilities are necessarily needing a handout so much as a hand up in this case, to really fulfil their potential.
According to a study released in 2021 by the Pan-African Medical Journal, young people are the most affected by HIV and AIDS in sub-Saharan Africa. The Uganda population-based HIV impact assessment indicated that HIV prevalence is 3 times higher in young Ugandans aged 20 to 24 compared to those aged 15 to 19. Karono urged parents and stakeholders to ensure that the youths avoid acts that can lead them into the HIV trap.
So there should be a lot of awareness in the community to let these people know that there are services that are there for them, the psychological services, the social services like schools and medical services, so that they can encourage.
HIV prevalence is almost 3 times higher among females than in males aged 15 to 24. Hope Nyongereza and Ibrahim Kasinga, CTV PM Edition.